Hi, I'm Mayor Jay Tibshraeny, and welcome to this edition of Chandler Inside and Out. Thanks for joining us today. Today in studio, our guest is Tim Bricker, CEO of Chandler Regional Hospital and Mercy Gilbert Medical Center.
Right.
So you are in charge of both the Chandler facility
Yes,
and the
sir.
Gilbert
I am,
facility.
yes.
And you've been with us before, Tim, but it's been about a year and a half or so. Why don't you talk a little bit about your background and what you got you into the Dignity organization, which controls both those facilities,
Yeah.
and then we'll talk a little bit about Chandler Regional
Very
today.
good. Well, thank you. Well, I've been here in the Arizona area for about almost coming up on 4.5 years with Dignity Health, formerly Catholic Healthcare West.
Mm-hmm.
I've worked in healthcare for, gosh, close to 30 years, actually. I started out in the state of Oregon, which is my home state, as a direct care provider. I provided nursing assistance in a nursing home when I was in college, actually. That's
Wow.
what got me into healthcare in the first place. And then did some in-home nursing care.
Was that a part-time job?
It was a part-time job during the summer, actually, after my
Okay.
freshman year in college. And then while I was in college, I had a part-time job as an in-home caregiver for a retired disabled professor.
Okay.
So that's what got me into healthcare in the first place. Eventually, after college graduation, I worked in healthcare policy. I studied government and public policy in healthcare in college, went to Washington, D.C., and worked on healthcare reform back before President Clinton was in office, actually.
Wow.
The last time healthcare reform was a hot topic in Washington.
When he became president in '92, that was a big issue.
Right. I was working for AARP on national healthcare reform policy. Okay. And then went back to graduate school and got a degree in healthcare administration at the University of Michigan. And then went to work for 12 years for a healthcare company in Salt Lake City. And I ended up doing a variety of things in hospital administration, hospital leadership, ended up as the president of a hospital in the Salt Lake area, and I built and developed several new hospitals in a fast-growing part of the country there. Went back up to the state of Oregon, back to my home state, and ran a small group of hospitals in Central Oregon for a few years, then did a little bit of consulting for hospitals and doctors around the country, and then came here and had a great opportunity. 4 years ago, I got a call about the CEO opening at Mercy Gilbert, and I came out here and got to know the organization and the area and was lucky enough to land that job. And then about 3 years ago, we combined the leadership positions over Mercy Gilbert and Chandler Regional into one, and so I've had the opportunity to work at Chandler Regional for about 3 years as well.
And for a young person, you've got quite an extensive background. I mean, very, very varied background. You got your master's then at
the University of Michigan.
Did you actually attend there physically or online?
I did. No, I was there physically. Lived in Ann Arbor and had season tickets to the football games.
Right.
And it was the School of Public Health. So I spent 2 years there. Yeah. My wife's actually from Michigan. That was one of the attractions to
Were you
Michigan.
working at the time you attended graduate school?
I was, actually. I was doing some research assistance with a professor around actually quality of care in long-term care facilities. I had a real interest early on in my career in long-term care.
And in San Diego?
San Diego, I was working as a consultant.
That was the consulting
part of my career. I was based in San Diego and traveling around the country, actually helping doctors and hospitals with strategy and hospital operations and really whatever they needed in terms of improvement and work.
So a couple, 3-4 years ago, then you came out here specifically applying for the CEO job.
Right.
With, at the time, was it healthcare?
Catholic Healthcare West.
Catholic Healthcare.
It was Catholic Healthcare West, right.
Right. And then Dignity acquired Catholic.
Well, it actually wasn't an acquisition. It was a name change. Okay. Same company, new name.
New name.
There was some change in the corporate structure. The company is based in San Francisco. And there was some change at the corporate level. And then there was a change in name. Dignity Health, then Catholic Healthcare West, was and still is a very fast-growing company. And there are about 40 hospitals within the company, some of which are Catholic hospitals, some of which are not Catholic hospitals. And at the time, as Catholic Healthcare West was looking to grow and expand, the name created a little bit of confusion. So as we looked to partner with other organizations in different parts of the country, some wondered if we were Catholic, some wondered if we weren't, and what would it mean to join us. So long story short, the name change was part of a clarification of the nature of the organization, that we're not a Catholic company, but we welcome partnerships and hospitals with all sorts of different backgrounds and faith traditions.
I'm glad you clarified that because I wasn't sure how that occurred. So under their umbrella, obviously, is Chandler Regional Hospital. Chandler Regional started out as a community hospital. It was acquired at one time at some point
Right.
by
By
Catholic
Catholic
Healthcare.
Healthcare West, right?
Right.
In the mid 80s,
Okay.
it was acquired, or I may have the dates actually a little bit wrong,
Right.
but back around that time frame was acquired. It was a community hospital, an independent community hospital, was acquired by Catholic Healthcare West at the time and joined the larger company.
And that hospital, and we'll concentrate a little bit on Chandler Regional, has grown with the community. Obviously, I've seen the picture. You guys have it at your facility, the initial groundbreaking, and it's an aerial. It's
Yes.
done from the air, and there's nothing around it.
There's nothing around it. You're probably talking about the outline of the people.
Right.
All of the initial employees stood and in the outline of the original plan of the hospital.
And that was like 85.
That was, you're right,
80,
that was
in
the mid
early
80s.
80s.
And that was when the hospital moved from its original location over on McQueen and Chandler Road,
right,
to the location where we are now. And
their growth and your growth, it's pretty spectacular. It kind of mirrors what's happened in this community, Chandler, in terms of how we've grown as a community, how we've grown as a city, all that we're, moving from a transition from a farming community to a very big innovator and high-tech driven community. You're the same. I mean, it was this little community hospital, like you say, roughly at the intersection of Chandler Boulevard and McQueen.
Right.
Very small hospital, and then moved over there, and the growth's been unbelievable. The technology and the services you're providing your patients is unbelievable too. But it's just, I look at that, and it's very similar to what's happened in Chandler, the way our growth and your growth have mirrored each other.
I think that's true, and the hospital has grown in size as the population here has grown, and it's also grown really dramatically in the complexity of services that we provide and the type of care that we provide, and we can certainly talk more about that. But it's grown up. I mean, Chandler Regional has become a large, what I think of as a regional referral center, no longer just serving the immediate area of Chandler, but we have patients coming in from quite a distance.
You're truly a regional hospital.
We really are a regional medical center at this point, absolutely.
And when you were here last time, we talked about, we were just getting, I think, ready to do the level 1 trauma, and I think you may have even got ready to start it, or you were a couple of months from starting. But talk about the level 1 trauma center that you are now, and what that means to the community, because it's a pretty significant thing. And then we'll talk a little bit about your renovation and remodel and addition
expansion,
and expansion plans out there and what you've been doing out there.
Well, you're right. We became a level 1 trauma center in March of 2014. And so we've been operating as a level 1 trauma center for just over a year. And what that means is that Chandler Regional Medical Center takes care of the most severely injured patients. That's what a trauma center is. And the way the trauma system works in the state of Arizona, there are 4 different levels of trauma centers, and a level 1 is the highest acuity hospital, meaning when there's an injured patient and the first responders respond on scene and they take the patient to a hospital, they go to the nearest level 1 trauma center, and now that's Chandler Regional out here in the Southeast Valley.
Because the only other one even remotely close would have been Scottsdale, North Scottsdale.
That's right, Scottsdale, and then there were, at the time that we became a level 1 trauma center, there were 5 adult level 1 trauma centers in Maricopa County, and they were all clustered downtown Phoenix, a little bit north, Scottsdale, John C. Lincoln. Great trauma centers, terrific medical centers providing really high quality, world-class care, but geographically not easy to reach when you live at distances out here in the East Valley and to the west.
And minutes means...
Minutes matter.
Minutes matter.
Right. We talked a year or so ago about this concept of the golden hour. And what that means is if you have a very severe injury, studies show that the faster you get to a level 1 trauma center, the better your chances of survival and the better you do with treatment. And so the percentages of people that live out here in the East Valley that got to a level 1 trauma center within that golden hour were quite low, less than 50%. And if you live out in Pinell County, it was down about 10%. I can't tell you what the numbers are now, but I can tell you that the percentage of people that get to a level 1 trauma center now, the numbers are much, much higher than they were. And so there was a significant community need, and that's why we did it. We built the level 1 trauma center because we knew that while we had great trauma centers in Maricopa County, they weren't distributed geographically in a way that worked real well for the communities out here in the East Valley.
Right.
So hence we decided to make those investments and build the trauma center here.
And the kind of volume you're now seeing, I mean, I don't know if you have any
I do.
statistics or you want to talk about the utilization of your level 1
Yep.
trauma center.
Yep. So we, as I said, we just reached our 1-year anniversary, and we saw just about 3,000 trauma patients in the first year, which is a lot. And it's actually a lot more than we expected. We were projecting 1,700 to 1,800 trauma patients, and we've been a lot busier than we anticipated, which is good and bad, I think.
Right.
I mean, it shows that there was a significant community need.
It's a two-edged sword.
It is, because these are very severely ill and severely injured patients, and of course nobody would want that, but the need was here, and that's what it demonstrates. And so the fact that we have a level 1 trauma center here in Chandler shows, and that we've been as busy as we've been, shows that there was a significant community need. And there's absolutely no question that people are alive today that wouldn't be if we didn't have a trauma center here in town.
Absolutely.
It's
Absolutely.
remarkable.
And I know a lot of different things factored into your decision when you said, we're doing this major expansion, this tower,
Right.
and talk about the tower and what's in it, because the trauma center is just part of that huge addition you just recently completed.
That's right.
But it's also a major investment of money and resources for you to say, we're going to go down this route. And so talk a little bit about that.
Right.
What have you.
Well, so we also just recently completed in September a major expansion of Chandler Regional Medical Center. We opened a new 5-story patient tower. We added significant capacity to the hospital, basically, to help meet the needs of a growing community. Part of that has to do with the trauma program, but a lot of that expansion was in addition to the trauma program. And we were building that new tower and that new expansion before we decided to develop the trauma program. So the trauma program actually came afterwards. We opened, as I said, 5 new stories, a 5-story building on the campus, which includes a brand new emergency room. We added 6 new operating rooms to what we had was 10 before, so we have 16 operating rooms now at Chandler Regional. We added significant new beds in critical care, again, the most severely injured patients, and then we added a couple of floors of what we call general medical beds for hospital patients. One of the most significant areas of expansion was in critical care, and this relates to the trauma program. Before we opened the new tower, we had a total of 17 critical care beds at Chandler Regional. We now have 49. So we went from 17 intensive care beds to 49, basically overnight. And since we opened the tower, we've actually filled up those beds on a few occasions. So again...
So the net difference is that those beds are in the new expansion,
Yes.
the 30 some odd?
Correct, 32 in the new bed tower, right. So the trauma center is part of that. Some of the new operating rooms are dedicated to trauma. The new emergency room has some very large dedicated trauma bays. So when a patient immediately comes in, that's where they go, and that's where they're immediately seen by the trauma team and the trauma surgeons.
Yeah. Good. I'll be right back at you because we did a tour of that facility about less than a year ago.
Right.
But I want to reintroduce the show, and then we'll finish up talking about the good things happening at Chandler Regional. And you can even give a plug for Gilbert Mercy if
Very
you want.
good.
we like that because that's serving people too.
Yes.
And actually, we'll probably ask you about that when we come back. I'm Mayor Jay Tibshraeny. You're watching Chandler Inside and Out. Today we have with us Tim Bricker, CEO of Chandler Regional and Gilbert Mercy Hospital under the Dignity banner. So again, thanks for being with us.
Thank you.
And maybe just real quickly, because we didn't spend a lot of time on Gilbert Mercy, which is right on our border basically on the 202. What kind of services does that hospital offer that are maybe unique, or is it similar to the general services at Chandler Regional?
Yeah, it's has some similarities, and it's also different. Mercy Gilbert, I think of more as a community hospital, and I think of Chandler as more of a large, complex regional hospital that draws people in from a broader geographic area. Mercy Gilbert does have some areas of specialty. We do an awful lot of orthopedic surgery at Mercy, and I would say that's an area of specialty services. We do a lot of orthopedic surgery at Chandler as well, but we actually do more total joint replacement, total knee replacement, total hip replacement surgery at Mercy Gilbert. Another area of specialty at Mercy Gilbert, I would say, is maternal child health. We deliver a lot of babies. We deliver a lot of babies at Chandler Regional as well. Just a couple months ago was the first month in the history of Mercy Gilbert, and it's been there about 9 years. First time ever that we delivered more babies at Mercy Gilbert than at Chandler Regional.
That's
So,
interesting. Because yeah, at one time Chandler Regional was known as being a big baby hospital.
and it still is. We deliver close to 4,000 babies a year at Chandler Regional. We have a very sophisticated newborn intensive care unit for babies that need to stay long. But Mercy Gilbert, the population is growing so fast around there. The birth rate is relatively high, and
it's right in the growth areas of both Southeast Chandler and South Gilbert.
It is, and to be fair, one of the reasons we're not growing quite as fast at Chandler is because we're full in our maternal child health center. So there will be a time in the near future where we see the need for some expansion, and at that point, I think the delivery volume will continue to grow equally as fast at Chandler Regional.
Yeah, and one of your former chiefs of staff, I think it was Dr. Goodman. I think Dr. Goodman, which that's his specialty, is delivering babies, and that kind of coincided with the reputation the hospital had at that time. That reputation now has expanded to include the trauma center and all these other uses, and so it's good to hear the trauma center thing is working out. You have some kind of agreement, we talked about it briefly last time, with Barrows Neurological Institute. Some of their surgeons are over here doing things. Talk about what their surgeons are doing here, but is that a contractual relationship or an individual relationship?
Well, it's a partnership. Actually, the Barrow Neurological Institute is part of St. Joseph's Hospital Medical Center in Phoenix, which is part of Dignity Health. So we're all in the same family.
That's part of the Dignity umbrella. Okay, I didn't realize
so
that.
The Barrow Neurological Institute and the Barrow Neurological Physicians came out here to Chandler about 3 years ago now and started doing neurosurgery here at Chandler Regional. And their business has grown very, very fast, partly associated with the Level 1 Trauma Center.
I would imagine.
Yeah, they're a significant part of the trauma center.
They're on call for those kind of things.
They're available immediately 24 hours a day, 7 days a week. And they are a critical component of the Level 1 Trauma Center. They're one of the requirements to have those high-level subspecialists immediately available to be a Level 1 trauma center. But they're also doing a lot of non-trauma work. So those Barrow neurosurgeons are very involved in minimally invasive spine, neck and back procedures for spine pain, not trauma-related, not traumatic injury-related, but more folks that have pain in their spine from a variety of causes. They do a lot of back and neck procedures on the spine. They also do a lot of brain tumor work, both malignant and benign brain tumor removal. And these are the most sophisticated neurosurgeons really in the world, working on world-class equipment. They have amazing computer navigation systems and computerized microscopes to help them find their way around the brain and the spine. And they're really doing the full variety of neurosurgery work at Chandler Regional. It's amazing.
The Chandler Regional has access then to all those services.
Absolutely.
How long has Barrows been affiliated with Dignity? How far back does that go? Do you know?
Well, it goes back to the origins of Barrow.
I didn't realize that.
I don't know the exact date.
Okay, that's interesting. I didn't realize they were affiliated. That's very interesting. Want to talk a little bit more. Maybe we'll come back and talk a little bit more about Chandler Regional, but we got about 10 minutes left. You have a new partnership with a health group, Adeptus.
We do. Adeptus Health.
Talk a little bit about that, because I think I'm going to be seeing you at a ribbon cutting dedication ceremony at one of your facilities with them. So what is this new partnership?
So Adeptus Health is a company based out of Texas. They're a Dallas-based company, and their business is freestanding emergency rooms. So what that means is an emergency room, it's actually a licensed emergency room in a location with a building, but without hospital beds attached to it. So it's really an outpatient emergency room. And in the Dallas area, which is where this company got their start, these facilities have a significant presence. They also have a presence up in Colorado in the Denver area. And they made a decision a couple of years ago to move to Phoenix and expand this type of facility and create this type of access to care in this area. We started talking with them, exploring potential opportunities to partner. And long story short, we ended up essentially doing a joint venture with this company.
It's a partnership.
It's
on this facility or multiple facilities?
Multiple facilities. We're starting, We actually, the first facility opened out in Levine, which was actually a small little hospital called Arizona General Hospital.
Okay.
And that's part of the partnership between Adeptus and Dignity Health. It's actually a hospital. So I mentioned the freestanding emergency room. What we built in Levine was actually a small hospital with inpatient beds. But coming soon in May to Chandler will be the first of the freestanding emergency rooms. And it's at the corner of Gilbert Road and Germain.
Yes.
On the southeast corner.
I've
Sorry,
watched
the
the
southwest
construction
corner.
faithfully.
Yes, that's where we'll have a ribbon cutting. And that will be the first of several of these smaller facilities that we'll be building around the market.
So it's an emergency room, like an outpatient emergency room.
It is.
So give us an example. Who and how would that facility be utilized?
Well, I think of it as somewhere between an urgent care and a Chandler Regional. So you could go to one of these freestanding emergency rooms if you had a broken bone, or if you were having an illness and you needed to visit the emergency room. What you wouldn't go there for is a severe injury. So an ambulance, for example, if you were being taken to the hospital by an ambulance, they would take you to a place like Chandler, Mercy Gilbert, where there's a hospital attached to it in case you needed to be admitted, or you needed surgery or something that the hospital has that these places won't. If you were having a heart attack or a stroke, you'd be better off going to a full service facility. But short of that, these facilities will be staffed and open 24 hours a day, 7 days a week, with an emergency room doctor, board-certified emergency room physician, and emergency nurses. So they are well equipped to handle quite an array of illnesses and injuries.
Yeah, and that's interesting because I've used, or at least my wife has, an outpatient facility where
Like
she was sick and she needed to get a prescription, whatever it was.
Mm-hmm.
So she went there, get some painkillers
Mm-hmm.
or whatever.
Mm-hmm.
I forgot. One time she hurt her back and she had them evaluate that, and they had to give her something for her nerves. But so you could still go there. This is probably, if you're having a problem, a step up from that, where like you think, man, I'm really not feeling really good. This could be an emergency. I'm going to go to the Adeptus.
Correct. The other difference is between the freestanding emergency room and an urgent care center. The urgent care centers close. They typically stay open till 10 p.m. or midnight, and then they close and they open up in the morning. These freestanding emergency rooms will be open all night.
24/7.
24/7.
So you got a problem in the middle of the night, you wake up and I need to take my wife or my spouse to the
And they're very convenient
doctor.
also. They're very quick access. Sometimes you go to the emergency room at Chandler Regional on a busy Friday night, Saturday night, Sunday night, and there can be a lot of people there. And our wait times are short. We get people through fast, but the freestanding emergency rooms often can be quicker and more convenient. Very quick parking, you park close to the door, you get right in, you get seen quickly, and you can get out quickly.
And they still honor the same insurance
They
that
do.
the other facility.
Right.
So how does this relate to maybe some shifting health patterns in the country right now? I mean, obviously more convenience, more access, less of maybe going to the big giant facility unless you're really sick.
Right.
Other areas?
Absolutely, yeah. There is more and more healthcare services are moving away from the hospital for a couple reasons. One, technology is allowing things that used to be done in the hospital to be done in an outpatient setting, and that's good. It's good for all of us. Convenience, fast, speed, throughput. The other thing is it's less expensive. With changes in healthcare reimbursement and with all the cost pressures in the healthcare industry, we're looking for ways to deliver healthcare in a more affordable way. And it's less expensive to get services in some of these outpatient facilities than it is in a big, complex hospital with a lot of fixed costs associated with it.
Yeah, that makes sense. So it's service to the patients and save them money, convenience.
Right.
Nothing wrong with that.
Yep.
It's part of the shifting patterns of what we're seeing with the healthcare. Any other patterns that you're going to see in the next couple of years?
Well,
you might want to predict
I would
on?
say similar sorts of patterns that have led us to facilities like these freestanding emergency rooms. A lot of pressure to keep people well and keep them out of the hospital. And so you're seeing a lot of investment in primary care physicians. There's a shortage of primary care physicians in the country, so you're seeing a lot of doctors partner up with nurse practitioners and physician assistants, these what we call mid-level providers that can help provide some of the primary care that the primary care doctors just can't because there aren't enough of them. So you're seeing a lot more outpatient and ambulatory sorts of services in neighborhoods and close to home. And I think you'll see more and more of that.
And real briefly, we got just a couple minutes left here. Any new expansions on the horizon at Chandler Regional? We talked about your last major expansion, a
Right.
lot of new services, a lot of new technology, level 1 trauma center. What's next?
Well, we are in the planning process for the next significant phase of expansion. We've gotten a lot busier, a lot faster than we thought we would in the new tower. And we're now looking out to the next 5 or 7 years to determine the next phase of growth. I think what you're likely to see in the shorter term, the next few years, probably some medical office space for doctors on the campus. I think the most likely significant expansion will be in maternal child health to help us deal with the fact that we're just so busy with deliveries of babies.
Because there's room on the campus for expansion.
There is some room on the campus. There's a little bit of room. We need to build a parking structure because parking is difficult. And if we can build a parking structure, we can take some of the flat areas that are parking lots and put buildings on them.
That makes sense.
So that'll be part of our future too.
Anything else you want to add as we get close to?
Well, we love what we do. You know, it's being a level 1 trauma center is serious business. We take care of very sick people. We see some very tragic and traumatic events, but we love what we do. One of the things that makes me so proud of working at Chandler Regional and Mercy Gilbert is that the people that work there are there because they are in service to others. And while it's very high tech and it's very cutting edge, it's a people business, and that's why we do what we do. And we're really very proud of it.
Good. Thank you very much. Thanks for
You're
being
quite
with
welcome.
us today, and
Thank you.
appreciate your service to the region.
Thank you.
I'm Mayor Jay Tibshraeny. You've been watching Chandler Inside and Out today with Tim Brecker, CEO of Chandler Regional and Mercy Gilbert Hospitals here in the East Valley. Until we see you again, take care and be safe.